Have you ever wondered in your practice why did your patient develop what he developed? We have been so used to prescribing remedies for different diagnoses and different constitutions. Once you find a totality or something very unique, you prescribe. But we hardly wonder that why did this patient who had an emotional trauma develop migraine? And why some other patient with a similar emotional trauma develop a tumor? And henceforth, we all say that it is because of some tendencies that we inherit. And these tendencies are some which are carried down from our forefathers, some by the process of living, we develop some kind of tendencies. But don't you think that when you are doing a totality of symptoms, if you don't include these tendencies in your prescription, you're half prescribing? This is exactly what used to happen to us earlier. By the fascinating knowledge of the newer remedies, we went on prescribing remedies after remedies and in different constitutions and getting wonderful results where the patient says that I am better, my everything is doing very well. But the problem was the recurrence. And to understand this recurrence, we had to go back to our old masters. And these old masters had given us the answer which we rarely even thought of. And that was the answer which was written in the book Chronic Disease by Dr. Hahnemann, where he talks about different miasms. Now, miasms are things that which we are really scared of many a times because we hardly understand them. But my dear friends, if we are not prescribing on why did the patient develop what he developed, then there is a chance that you are partially prescribing in a case. Many times we all have that single remedy results where you give that one dose and the patient is better. Obviously, because that remedy covered the miasmatic part also. And to find a remedy which covers the whole of the miasm with the constitution, with the keynotes and the pathology is a rarity in practice. And many times they are only seminar cases. So every time in your cases, think about this. Why did the patient develop what he developed? And the remedy that you have prescribed covers the why, or it is only a simillimum on symptoms. This will be a new thinking for those who have not included it. And you will surely find your answers if you go back to your old masters like Allen's, then Dr. Hahnemann, and many others. So, happy backward journey to you.